Well, our first speaker of the afternoon session is one of Europe's leading professional advocates of anti-aging medicine. Having established an anti-aging practice in Brussels, as well as the European Academy of Quality of Life and Longevity Medicine, and now assisting in the curriculum for the world's first postgraduate course for physicians to graduate in anti-aging medicine, he is an extremely active individual. I am confident that his energy will be conveyed to you in his lecture, which is about one of the most potent and perhaps controversial hormones used today in anti-aging medicine. Please welcome on the stage Dr. Thierry Hertogue.
Thank you. Thank you, Phil, and I want to thank Phil and the organizers for organizing really a great conference. I find the context very exciting here. And the lectures, I'm going to talk to you about a topic that is maybe controversial, but is extremely important in anti-aging medicine. And some of the slides will be information of one of my next books that will be only about the scientific facts of growth hormone therapy, and that makes sort of meta-analysis of all the studies that have been published so far, at least in adult growth hormone therapy. And you have the pro, the contra, and the neutral, and I must say that the results are extremely in favor of giving growth hormone therapy, but under guidance of a physician who knows how to control cancer and other risk factors. Now, first of all, hormone is made by the pituitary gland. So it's a very major hormone there, and about 40% of the anterior pituitary gland is making growth hormone. Just looking here for the slides. Next slide. And most of growth hormone's action will be anabolic action. It will make our body be bigger and have volume and tension. It also stimulates the immune system on all sorts of aspects of the immune system, but also on specifically on the thymus. Next slide. I'll try to put it here. Yes. Mental functions are extremely improved by growth hormone. This is in fact a major hormone who, for instance, gives a major feeling of inner peace. And one of the things we have to know is that a lot of growth hormone's action is mediated by another hormone that is called IGF-1, insulin-like growth factor 1, or somatotropin C. And so the liver has to be in good function because most of that IGF-1 is made in the liver. It has to be in good function in order so that growth hormone can have most of its action. But we have to know that there's a whole endocrine axis. And if the target cells are not in good state, there are not enough receptors for growth hormone, even a good therapy will not work. And there are several ways to improve the growth hormone receptors. Here's the pituitary gland, and about 40% of those cells of the pituitary gland make growth hormone, also in adults. And we know that the pituitary gland is extremely important to make hormones that stimulate other endocrine glands, like the gonad, the sexual glands, or the adrenals, or the thyroid gland. But those are just minor secretions compared to that one of the growth hormone of the pituitary gland in adults. And it is interesting to know that the dose that is made in a young adult that is healthy of growth hormone is around the 0.35 milligrams per 24 hour. So making 350 micrograms. Gives you an idea when you treat, if you give 0.5 milligrams, that might be too much. And well, we see here IGF-1. We'll go over because there are a lot of slides and I want to focus on some. This is the powerful anabolic action of growth hormone. If there was not enough growth hormone, a person stays small. You see here a person, and it's a little fatter and doesn't look so good, I would say. And when you get too much growth hormone during childhood, you grow too young. This gives you an idea of what growth hormone can make. This is no other hormone that can have such a powerful effect. And this is to compare to a normal-sized person, a person who has too much growth hormone. So endocrinology is very easy. You have to use your eyes. You need your eyes to see, and you can see what has happened in use by just looking at the building of a person. I'm just going to focus now on growth hormone. You see, this is a person of 22 years having a growth hormone deficiency. And you see a normal boy of 10 years, about the same growth. Without growth hormone, we stay small. So, I want to focus on this mental power. This is a good slide that gives a good idea of what growth hormone does. You see also that her jawbones are quite big, so she can't really have inner peace because she has a lot of growth hormone. And that also gives a lot of muscles, so it gives really power. And people who do not panic in stress situations really feel good, and you see that on the eyes that a person feels good in very difficult situations, are usually persons who have a lot of growth hormone or are treated by growth hormone. So how does a growth hormone deficiency appear? Well, with time we age quite quickly in our growth hormone production. At 40 years, there's about half of what a 20-year-old can do. We don't need the dose of 20-year-old because 20-year-old, at least in men, they have to enlarge those, so they still have an excess amount of growth hormone. But the dose we should have is about 0.35 milligrams. And at 40 years, it's, in this study, it has vanished to about 0.2 milligrams. So there's already a 45% drop. And it's much worse in men who are not lean. Men who are obese have an even much lower level of about 60% less than a non-obese person. So you have advantage of not being obese. Studies have even shown that when you lose weight, you increase your growth hormone secretion at least in half of the men. And IGF-1 also decreases with age. So inevitably, the body stays as big as it was before, and with this decrease, there will be a lack in the cells. And this is not an adaptation. This has nothing healthy. And a lot of aging is growth hormone deficiency. When you compare, for instance, aging, normal aging, and growth hormone deficiency symptoms, and you analyze the different systems, like the muscle mass, muscle strength, etc., decreases with aging, well, decreases also with growth hormone deficiency, and it improves back again with growth hormone treatment, and it's often, at least for the muscle mass, is improved also by growth hormone excess, but then excessively improved. Fat is the only item here in this list that increases with age. Well, it also increases with growth hormone deficiency, and it decreases with treatment, or and also with excess. And all for the other parameters, bone, cardiac indexes, etc., liver size, same information. Decreases with aging, decreases with growth hormone deficiency. It increases significantly with growth hormone treatment in double-blind, placebo-controlled studies, and with growth hormone excess. And there are a lot of studies on growth hormone. I finished almost a book on the scientific facts about growth hormone therapy. It's I think has quite a lot of information. And the information, for instance, on quality of life, there's something like not so much double-blind, placebo-controlled studies, about 8. Well, there were 5 in favor, 2 neutral, and 1 no. There were nothing against. The studies on body composition, there's about 64 studies on body composition with growth hormone therapy for the last 30-35 years. And all of them has had a significant beneficial effects on body composition. There's not one that has not had, on the long term at least, a significant effect. That means significant effect means that there's certainly not more than 5% chances that we're making an error in that. Now, when we look at the complaints, how does a person with growth hormone deficiency feel? Well, in my patients, I made a study. on the poor resistance to stress is an item that is in a lot of cases there. About 90% of those say we have this problem. Excessive emotional reactions, in about 70% of the patients says I cannot react to stress without excessive emotions, and that bothers me. They have sharp verbal retorts. In fact, what we have then is adrenaline outbursts. Not enough of growth hormone. This is a parasympathetic hormone that stimulates parasympathetic system. Then you have the orthosympathetic system that goes up, and goes very much up if the growth hormone deficiency is very severe, and from there the sharp verbal retorts. Anxiety is extremely important symptom. It's only about 70% of the patients complain of this symptom, but when you really ask, are you controlling your anxiety, or it's spontaneously that you don't have to do any effort in order not to be anxious? Well, often the people say, who have low levels of IGF-1 and growth hormone deficiency, say, in fact, I have a good philosophy, I try to have positive thinking, etc., but I have to do an effort in order not to feel this anxiety. Tendency to social isolation is also, that's the person who will not have a work often, will be jobless, will want to be sheltered at home, and will not want to go in the evening to parties because he doesn't feel so good. And sense of power. And all those symptoms improve drastically with growth hormone therapy. There's only a minor part of patients, about 20% of patients, or maximum 30% of patients that do not improve on those symptoms with growth hormone. Also, other permanent fatigue. Now, there's one typical symptom of growth hormone is that if you really are sufficient growth hormone deficient, you don't have fatigue. You have exhaustion. Exhaustion till the end of your days if you don't treat yourself. Exhaustion. You cannot recover anymore. You need 10, 12 hours to sleep, and even that is not enough to recover fully. With growth hormone, I had a patient who was had 17 hours necessary. A person who went to school 17 years, couldn't go to school anymore. Now, on growth hormone, she was growth hormone deficient and a lot of fat, she sleeps about 6 hours. I must say also that another factor has intervened. She has fallen in love, was probably not able before growth hormone. So there was another factor that was not under control of science. You see growth hormone deficiency, chronic fatigue syndrome, they have a lower IGF-1 level, so about almost 40% lower levels in general, and the growth hormone secretion at night, that it happens mostly at night, the growth hormone secretion is about half of what it is in normal individuals, so no wonder why they have fatigue. Growth hormone and depression, you see that severe depression, those endogenous depression, they have half of levels of growth hormone secretion, whatever item you use, if it's sleep rate, or 24-hour growth hormone level, or whatever, or you stimulate the secretion of growth hormone. That is the same. Also, low self-esteem is present. And I'm focusing on those symptoms because it's very important also when you do a treatment in order to follow the treatment. These symptoms have to improve with treatment or you're not on the right direction. Growth hormone breeding, you see that we have the forced expiratory volume decreases with age, and all those things can improve with growth hormone therapy. In, for instance, obstructive bronchopneumopathie, you see that they improve with growth hormone, they breathe more deeply. And this can be measured by measuring the chest circumference when they have maximal breathed there and hold their breath, and maximal expiratory volume, and it does improve after 2 months of growth hormone therapy. You have about 2 centimeters or 1.5 inches of improvement maximum. The quality of life, this is the meta-analysis on the quality of life studies. I was talking about you that we had 5 studies before, pro, 2 neutral, no significant effects, and adverse 0. But when you look further in all studies, also the open studies, not only double-blind studies, there's about 26 studies, well, 23 on the 26 studies have shown a significant beneficial effect by growth hormone therapy. I don't think you find other substances that has such a favorable outcome. Also, the link between plasma levels, either of growth hormone, either of IGF-1, with quality of life, well, 94% of the studies, almost all except one, are positive. There's no adverse reactions. Extremely important hormone for the quality of life. And its improvement even 12 months after treatment. During treatment, the improvement continues to go on in 59% of patients, about more than half of the patients. And after 6 months, in certain studies, there's only 30% of patients that have improved. But when you look the improvement on 1 year, it's 62% extra, so 92.7%, almost all improved. So you have to wait a certain time. It's not a quick hormone. It's quick in some patients, but it's not extremely quick. And it's better and better. In myself, I am under treatment. Even the 3rd year, I had a better quality of life than the 2nd year, and the 2nd year was better than the 1st year. And this has gone on for 4 or 5 years, and finally I'm stable on my hormones. This is how a person looks like when she's growth hormone deficient. Could I go back one slide? No. Okay, good. You see excesses. Body fat in an adult onset growth hormone deficiency. That person has had enough, but then there's suddenly not enough. They have, for instance, the quantity of a dwarf for a big body that does not, then so that body loosens up, and etc. While if that person never had a lot of growth hormone, that person will always have been small. That's how you could know if growth hormone deficiency has started in childhood, the person is small. If growth hormone has started in adulthood, the person is big, but is aging. And we'll have to go a little bit quicker, I think, with the slides. Next. Doesn't go. Probably have to push. Hair. Hair is small. There's a sort of hair lost bilaterally, and it gets thin. Atrophic is very thin, and you have droopy eyelids, droopy nose tip. There's thin lips, atrophy of the lips, atrophy of the jaw bones, thinning of the eyebrows. You see how thick the skin is in growth hormone excess, how big the nose is, how big the jaw bones are, and how thick the hair is. And you see when it's growth hormone is lagging, you have skin folds under the chin. And that is the frequency. Frequency about 70% of all those symptoms. And the most important to look is sagging cheeks at the back. And that is also the symptom, the sign that will improve the most after 2 to 3 months of treatment with growth hormone. About 70% have, 75% have an improvement in this symptom. This is before, this is after 2 months of growth hormone and 4 months of testosterone. You see where the changes are quite important. And you see the thin skin here, growth hormone deficiency, and thin skin. When you give growth hormone, this does improve in several percentage of patients, but not so much as sagging cheeks. And also the skin thickens about 7% in one study. This is the major study about Rootman on aging persons. And you see how thin the skin is. It's dehydrated, typical of growth hormone deficiency, thinning of the skin. You can really have skin folds very easily. You see how thin the skin is. Dehydrated, lack of sweat and sebum, skin atrophy, not a lot of blood flow. And there's also a gain in water. When you give growth hormone, there's a hydration of the body. 3 kilos in that previous study. And you see how there's a flabby belly, and it's with age we all are going to have a flabby belly if we, well, a lot of us at least, if we don't follow anti-aging medicine. And you see that how fatter the person is, how lower the peak of growth hormone by stimulation can be. So there's less growth hormone secretion. You see, this is a person probably under treatment, but that is a bit how a person will be during treatment. It takes about 2 to 3 years to arrive to that stadium without changing your diet. Frequency of patients with unimproved sign. For the flabby belly, there was about half of those improved in the study I did on 48 patients. And you see lean mass improves with growth hormone and fat decreases tremendously. About 6 kilo decrease in this study on half a year of treatment with growth hormone. But those major improvements are mostly the fact of very severely the growth hormone deficient adults. You have lesser effects in a person who have less growth hormone deficiency. So it's in full-blown over deficiency, you have always even more improvements. Also the skin folds in normal people is thinner here in green, and in red is the skin fold of people with growth hormone deficiency. But it's, so in all the studies on body composition, well, I was wrong. I have more studies now. This is already an old slide. Well, you have 100% deficient in all studies, but in the double-blind placebo control study, there was one neutral study. Why? Because usually most of those double-blind placebos started 3 months or 6 months of double-blind placebo control and then went over to an open study. And at the end, there was significant effect. And here, after 3 months, in that only study here that is non-significant, after 3 months, there was not a significant improvement, but there was after a year of open treatment. Plasma IGF-1 or growth hormone levels, 86% of the studies show benefit significant positive association, and there's no adverse. So this is the typical outlook that a lot of men are going to have, and women, and so I advise you not to wait too long for a treatment. There are several physicians here that can treat other physicians. Don't wait till it's too late. You see also the sagging belly, and let's try to go a little bit over the droppy muscles on thing. Inner sides of the sagging inner sides of the thighs, 60% of patients were complaining, and half of those were improved with treatment. The muscle volume increases with growth hormone, and specifically the muscle and fatty. This is the sagging, droopy triceps. Well, it improves with treatment visibly. You really can see it after 2 or 3 months of efficient treatment in many patients. Well, a lot of studies on the bone content that is improved with growth hormone, 10% more here in this study. Fracture prevalence in growth hormone deficient patients is about 2.5 times more, or even more, between almost 3 times more fractures. When there's growth hormone deficiency, improvement with treatment, even the genitals, if there was always growth hormone deficiency, can be in minimal size. And in order to improve this, you need also to give growth hormone. You see that the scrotum and testicles do not depend on growth hormone so much, but it does depend much more for the penis size. So this is typical aspect, fatty cushions above the knees, less muscles around the shoulders and the buttocks. And there's a definite link with the age-related diseases, and well, cholesterol is lowered by growth hormone, and cholesterol, HDL cholesterol is improved. So that.
This is the end of the recording on side A. Turn the cassette over to side B.
Important studies is not the one I want to have. You see that there's a progressive increase in edema media with age and atherosclerosis. And this can be measured with echography. And you see that the growth hormone deficient men has significant thicker inner wall of the carotid arteries. That means all the arteries in the body everywhere are thickened and have atherosclerosis. And it takes 6 months of growth hormone treatment to completely normalize the situation. And this is not the only study. There was another study that confirmed these results. And you see that the arteries, they become rigid with age. They do not distend very much. and the sensibility increases very much after 3 months, and even better than before. They are even more younger than age-related controls. The diastolic blood pressure decreases here with growth hormone therapy. The total peripheral resistance decreases. It's really a hormone that improves after a certain time, but not in the beginning. If you have a hypertensive patient, be cautious in the beginning. Go on a slower dose before improvement. Impaired cardiac performance with growth hormone deficiency, and it improves with treatment. In green, the treatment; in white, growth hormone deficiency. You see that the cardiac index is really improved. So, going a little bit quick, but just to give an overview, let's look a bit on longevity. A study where mice was treated with growth hormone, and when they were old, 18 months is old for mice, and at 3 months later, normally all the mice die. You see there's no mice left here, and all the growth hormone, almost all the growth hormone deficient mice lived longer. But then after they died, so it only prolongs the average lifespan of about 3 months. But this is important, 3 to 4 months. It's like somebody of 80 years would have had, 75 years would have had growth hormone, and it permits him to live maybe to 90 years or 92. That is significant of interesting importance. So to make the diagnosis, you have to count on clinical symptoms, clinical signs, and also the therapeutic test. It has to work, but also blood and 24-hour urines. And which are the tests that I would propose you to do? Well, first, plasma test. It is important to do these IGF-1 with IGF-PP3. Do not work with a laboratory who does not do the two testings. You have to have the two hormones, if possible, done in the same laboratory, so that we have on the same blood sample the ratio between the two. We need to have an IGF-1 that is higher and an IGF-PP3 that is lower, but not too low for the IGF-PP3 and not too high for IGF-1. And these are more or less optimal values, at least for men, about 300 to 350 micrograms per liter for men, for women 250 to 300, to give you an idea. But if a person is very, very big, very muscled, the values often have to be higher. If a person is very thin, small, etc., values have to be lower. So it's just to give you a general idea. Micrograms per liter. IGF, you see that in women is lower. IGF-PP3 should be about 3,000 micrograms per liter. What does this mean? This means that you should always have 10 times more IGF-PP3 than IGF-1. If you have a lower ratio, that the IGF-1 and IGF-PP3 is very high, IGF-1 is low, and it's, for instance, 20, that is not good. There's clearly growth hormone deficiency. It is important also during treatment not to excessively give growth hormone in order to not promote any cancer possibility. And so it would not be good to have, for instance, a 600 IGF-1 and a 2000 IGF-PP3, because that could eventually favor colon cancers. It will decrease rectum cancers, but it will increase colon cancers, and possibly also breast cancers and prostate cancer, although there are conflicting studies on prostate. Having low IGF-1 in one study I saw was promoting prostate cancer. So just try to be safe, try to remember there's a ratio of 1 to 10 with the IGF-PP3, with IGF-1 to the IGF-PP3. Now, plasma growth hormone can be done by stimulation test. This is to get paid back by home, but it's not really, it's just one of the different stages of the access of growth hormone to IGF-1 that we're following, and it's only to get paid back by insurance you need to have 2 lower tests. And you need to have at least tests between less than 10, and in America it's less than 5 nanograms per ml of growth hormone to have paid back by insurance. Growth hormone in 24-hour urine is a good test. It gives an idea about the growth hormone production if it's well done by a good laboratory. And there is a little problem for 10 to 15% of the patients. That's an unreliable test. They seem to lose growth hormone, although they are growth hormone deficient. But it can give a good detection of very extreme deficiencies and excesses. And let's go a little bit over this. And what about the treatment of growth hormone? We saw this difference. Huh? So you have to look with your eyes during the follow-up. And in order to have improvement with studies, following the studies, there's significant improvement already of body composition on very high dose after 2 weeks. The quality of life improves also after, let's say, 2 months to 3. But all the rest needs at least 3 months of improvement to have a significant improvement. So you have to have some patience with this treatment. It's not from one day to the other it will change. And for plasma triglycerides, sometimes it takes more than a year to have improvement. And for bone mineral density also, sometimes it starts really after 18 months because growth hormone first stimulates the bone resorption, the bone loss. So you can even, the 3 first months, it can be a lowering of bone density in the bones because of growth hormone treatment. While afterwards, the bone will enlarge, the atrophy will go away, and it will increase in bone density because there will be a bigger stimulation of new bone formation. And treatment of growth hormone deficiency, you have the doses. There are several sorts of treatment. Physical activity, food, eating proteins is very important. Growth hormone secretagogues give, but the mightiest, the most powerful growth hormone secretagogues are other hormones. Testosterone is probably the major one. Thyroid hormone is probably the number 2. Melatonin has positive effects. Estradiol, transdermal estradiol, not oral, not that does have adverse effect, improves. But the best treatment of all when the deficiency is severe is to give also growth hormone in conjunction probably with all those good growth. And so, okay, I hope we won't have problems. What is happening? Excuse me, could you go back to the slide 160 or something like that? Okay. Growth hormone is secreted in the beginning of the night, so we'll try to imitate the peak. And when you imitate the peak, you can imitate either by intramuscular injection, either by the subcutaneous injection, but the effects are about the same of the two. In studies that I've shown, it's about the same, so I propose subcutaneous hurts less, and there's less risk of having adverse effects on the muscles, so it's better subcutaneously. Once a day I would propose to do it. Without stop. Eventually you can take 1/3 in the morning, 2/3 in the evening for some individuals, but most do enough with once a day, has also been shown in studies. And it is clearly before bedtime is the best moment. There will be more receptors, so you will have a greater efficacy, in my experience at least, if you really give it before bedtime. And do you have to give it? Well, on the belly or the thighs, or you change place regularly. Otherwise, there's a local hypertrophy that can take place. What are the doses for an adult? Well, you have to be in that range of 0.35 micrograms. You have to be more for bigger persons, smaller for smaller persons. And it's 7 times lower than in children. Depending on the deficiency, there will be different doses between 0.5 and 1 milligram a day. I must admit that I am myself taking about 0.015, so extremely lower than that, but there's rarely so that individuals are so sensitive to it. If I take more, I am getting too much muscles and swelling of feet. So 7 times lower than in children. Children need much more. Now, the average dose for mental improvement is 0.10 milligram in a multiple hormone replacement therapy with all the hormones that stimulate secretion of growth hormone or its effects, with testosterone, etc. When you give all the hormones an aging person is deficient in, you need lower doses, and this is, you need at least 0.15 or more to have a clear physical improvement. You need more. Often double of what is necessary for you. Don't be so afraid of diabetes. You see that patients with diabetes have very low IGF-1 levels, but you have to be more careful with that. You have to go slower. Cancer, there's, we can talk about this in discussion. I'm trying to have, it stimulates the immune system in lots of places. Some of the slides are okay. Going to see some of the cancer information. This is a study where in prostate cancer patients there was a 20% reduction of the IGF-1, very significant compared to healthy persons. And it improves when you take out the prostate cancer. Patients that had gastrointestinal tumors removed, they lived longer if they got growth hormone therapy afterwards, after surgery, and they had less recurrence of cancer, and the period before cancer reoccurred was longer, so significantly, 62% longer period free of cancer recurrence. Children who had brain tumors removed got the first recurrence of brain tumors was decreased by 40% in those who got growth hormone treatment, and mortality was decreased by 50%. So there are really studies that show beneficial effects. There's studies also where you block cancer of the breast cancer by growth hormone and insulin in conjunction with insulin. And you can also block liver cancer that provoked by chemicals. Now, let's go back. Other side effects you could have is edema. But you just have to lower the dose. Muscle pains also, just lower the dose and then it goes away. Half dose is already, if there's swelling, you can take potassium supplements. Take potassium supplements, treatment, and if it's not sufficient, you increase the dose. Excessive muscle development, you just decrease the dose, of course. And acromegalia, you won't have acromegalia if you go on safe doses. The ones I give will not appear, and you avoid side effects. Rheumatic pains, fibromyalgia. Okay. Let's go just for the last one. Rheumatic pains is also something that comes up when the dose is too high. There's a sort of swelling, there's retention of too much water that decreases. I have 3 books that I've published, one on DHEA that has all the effects, but the ones on growth hormone is in French, Comment rester jeune plus longtemps, published by Albin Michel, and there's also the hormone solution that had just come out as a book that is for patients, but what you really will have now is books only for physicians on how to do it and on the scientific facts, so a sort of meta-analysis. I wanted to talk to you on, could you put the last slides that I proposed to put before we have some lecture? Last slides, we should show them. 182 and 181. Is it possible? I hope they can. What I wanted to say to you is that we're studying in Europe with several 2-year educational programs. Oui, prochain? Prochain? Okay. Here, we started in Belgium, in Charleroi, for a first year that has been completed from whole educational program on anti-aging medicine. It includes also the psychological features that supercentenarians have that are different. The food in certain populations in the world, they live much longer, and the diet has been analyzed, and all those topics are in that. There's also environmental the pollutant problems, and problems, of course, of hormones. Those are where the lectures that had the most of the success, vitamins, minerals, and etc. The whole orthomolecular approach is it, and it's really in universities getting in. In Heidelberg, it's not completely yet in the university, but it's a university professor that leads the whole team there, and all the programs have been harmonized on Europe, and we're trying to be more or less the same program. The second year is, the first year is theoretical, the second year is very practical. It seems that it starts in Barcelona in Spain, but I'm not 100% sure about the information, and I'm doing some lobby that it would be in London, United Kingdom in next year. Also here. So I think it's very important that we have some sort of formation that we can say what we're doing is very scientific, and it has to be scientifically done. Next slide, please. Okay, this is the slide. I'm doing also a workshop. There's one in Paris in French, in English in Miami, a super practical workshop where people who have already some experience can share their experience. There's also a basic therapies course in Paris. And also in Orlando in English, there's the optimal workshop, the basic workshop. I think it's important that what we do is as scientific as possible, and I think this is a way of going in to share the information. Do you have any questions? Is there a microphone for the person who wants to ask questions? Henry? So I have about an 8 to 9 years experience of growth hormone. I think it's an extremely valuable treatment. It's very impressive, but there are certain things you have to watch out. If a person has cortisol deficiency, growth hormone can increase cortisol production. It's better to decrease doses or to eventually correct the deficiency. Do you have a microphone? I think there are people there.
You have mentioned about the use of growth hormone in terms of anti-aging. Actually, you haven't even touched on the use of growth hormone in terms of wasting syndrome and AIDS, and also our university center where we are using growth hormone in priming those patients who are going for liver transplant. And we find that those patients who are pre-treated with growth hormone before going for a liver transplant due to carcinoma of the liver, they do much better because we put them into better protein balance. The albumin goes up, the platelet goes up, the white count goes up, and there is a positive protein balance, and post-operatively they heal much better.
Doses are much higher, I think. You have to use in those cases because of the wasting syndrome they have.
Right. With AIDS, it's 6 milligrams per day. But yes. Whereas with our own experience with liver transplant in liver cancer patients, the growth hormone is about 1 to 2 units.
And it's not harmful?
Not at all, because in liver cancer, there are no growth hormone receptors in liver cancer, hepatocellular cancer. And recently, there are 4 papers coming out of JCI indicating that those people who are obese with waist-to-hip ratio greater than 1, using the American standard and using the Asian data of greater than 0.95, these are the patients that should be treated with growth hormone when they go on a weight reduction program. And when you commit a patient on a weight reduction program, giving them exercise and dietary and nutrient supplement, micronutrient supplements, those are the patients that are really doing well. And I feel that this is not emphasized because it is very important. I agree with you absolutely. That growth hormone, if it is used, it has to be used early. For example, we don't give hormone replacement to women at 70 years old. I think we should give growth hormone much sooner than what is recommended.
One of the aspects you said was very interesting also is the weight reduction program it decreases the conversion of T4 to T3. That means that thyroid activity goes down. When those patients receive growth hormone, it has been shown in studies, it's improved and they don't have a decrease of T3. And that's one of the reasons why they continue losing weight easier while maintaining also and improving their muscle composition, their body composition, muscles. And
I'm sorry, Dr. Hertogue, we are running out of time, but I can remind everyone that there will be a questions and answers session on Sunday morning. Okay. So very welcome to make those known then. Thank you.
Okay, thank you. For the brochures, for the seminars, there are one of the booths that will have, or maybe others, will have some of the papers for the seminars if people are interested. Thank you.